Good afternoon. I am Dr. Amit Haldar. I am working as a consultant neurologist at FORTIS hospital and in Park Clinic. My subject of interest is epilepsy. Now, I want to say certain things regarding epilepsy. Epilepsy is one of the common chronic neurological disorders, and it affects all ages. So, whether you are a child or whether you are an old man or woman, you can have epilepsy. Now, what do we mean by epilepsy? Firstly, we have to know certain terms. One of them is seizure. Seizure is transient occurrence of signs or symptoms that are caused by abnormal discharges of the neurons in the brain. Now, when someone has more than one unprovoked seizure, then someone is said to be suffering from epilepsy. Nowadays, they are saying that even after a single unprovoked seizure, one can be said to have epilepsy if there is a high chance of recurrence. What causes epilepsy? The causes of epilepsy vary. It depends on the age of the individual. So, in a very young child or in newborn, it is mostly due to malformations of brain development, or it can be due to some perinatal insult where the brain did not receive enough oxygen or when the brain did not receive enough sugar. But on the other hand, in young adults, these are mostly due to genetic causes or syndromic epilepsies. On the later in life, it is mostly due to head injury, due to brain tumor, and also strokes can lead to epilepsy. Substance abuse is another important cause of epilepsy. Infections worldwide, especially in our country, are an important cause of epilepsy. These include tuberculosis, various encephalitis, and even neurocysticercosis, a worm which enters the brain and can later lead to development of epilepsy. In the elderly, on the other hand, the causes of epilepsy are different. It is mostly due to degenerative illnesses like Alzheimer's disease or vascular insults to the brain, which causes brain shrinkage and leads to epilepsy. Some of these causes of epilepsy actually are preventable, some are not, but all of them are treatable. Some of them can be very well controlled if you take the medicines regularly. There are a lot of medicines which are available for treatment of epilepsy, but most important thing is that you have to ensure proper compliance, means you have to take the medicines on a regular basis. In some cases, the medicines have to be taken lifelong. If there are some adverse effect of the drugs, then you have to report to the doctor immediately. Some of the patients of epilepsy, around 30% of the patients of epilepsy continue to have seizures in spite of taking adequate drugs. They are called refractory epilepsy patients, and in such cases what is important is to do a proper surgical evaluation, and you have to pre-surgical evaluation. You have to do an MRI of the brain to find out any lesion of the brain that is causing the epilepsy and which can be surgically treated. EEG is another important diagnostic tool in the diagnosis of epilepsy. EEG not only helps us in confirming the diagnosis of epilepsy, in certain cases it can also help in identifying the type of epilepsy, and the type of epilepsy decides what form of treatment you can give. If it is a generalized epilepsy, then probably sodium valproate is the drug of choice. In women of childbearing age, there are other drugs which can be tried. On the other hand, in the cases of focal epilepsy, there are a lot of choices including oxcarbazepine, levetiracetam, lacosamide, and certain other new drugs which have come out. Apart from treatment of epilepsy, one has to look after the social and mental well-being of persons with epilepsy. A lot of them are found to have coexisting depression, anxiety, and other things. So, when someone is treating a person with epilepsy, one needs to address all the issues, and most important of all, one has to convey the message that epilepsy, whatever be the form, is treatable, and in some cases it can be also cured. In some cases you have to continue medicines lifelong. All of us know that 26th March is celebrated worldwide by persons with epilepsy as the Purple Day. Thanks to Cassidy Megan for initiating this movement and for carrying the battle against epilepsy to the society. So on this occasion, I wish all the persons with epilepsy and their relatives a good future, and I would like to thank Sanofi for giving me this opportunity to address the people on this occasion. Thank you.